The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
So, Dr. Hamilton, what exactly is a facelift?
So facelift and necklift, these are surgical procedures that we do. They are geared towards it's rejuvenating the face and neck. So this is the most powerful option we have in our armamentarium. So non-surgical or surgical, this is the pinnacle of facial rejuvenation. And I view the operation as addressing three components. So one is restoring or anti-gravity. So we want to restore where the tissues were originally positioned. So getting everything up. Number two is restoring lost volume. So we know our facial skeleton shrinks, our fat pads shrink. And then on top of it, our face and the skin and the tissues get lax or loose. And so it's almost like we have the balloon gets deflated and then the balloon is saggy on top of it. So we want to restore volume, and there's a couple ways to do that, but fat grafting or fat transfer is favored right now. And then secondly, we remove the extra skin once we've restored and lifted the structure. And some individuals will also include a chemical peel or laser resurfacing to a certain degree at the time of their facelift as well, or afterwards.
That's a great answer. And then we'll be getting into the anatomy more of the face in just a second. So what is a neck lift as opposed to a facelift?
So this is a good question. So, face, clearly, you don't need to be in medicine to know this, but we consider this starts at the jawline, and neck is everything beneath that and down. Dr. Kim, do you do face only or neck only, or is this something you tend to combine, and why?
Yeah, it's hard to do only face and it's hard to do only neck, because the face, as a plastic surgeon, we're thinking of the face, but also just above the jawline. Well, most patients have a little loose jowl skin. They may need the muscles in their neck tightened. They need their neck skin tightened. That's impossible unless you go down towards the neck. The flip side is also true. We could do a neck lift that's very isolated, and we can drape the skin behind the ear. Sometimes, though, you have loose jowl skin, or when we tighten the skin behind the ear, you have excess skin that sort of pops up in front of your earlobe. Well, the only way to deal with that skin that pops up in front of the earlobe is to actually make an incision in front of the ear. And then, by definition, that's a facelift. So I think that maybe very young patients in their 30s or 40s might get away with isolated procedures like only a face and only a neck. But the vast majority of patients do require both at the same time.
Right. And generally speaking, when people are coming in, they have a real reason to have surgery, although there is a trend to having a surgery younger. We'll talk about that too. But you can imagine you don't want to look like a bobblehead. So it limits us. We can't create this really tight, really dramatic jawline if we're having significant sagging, deep folds, because we want the result to look harmonious. We want it to look natural, and people don't age in pieces.
Yes.
So we don't want to have your face look exactly the same, and then the face of a 50-year-old and the neck of a 30-year-old. That just doesn't make sense. So I agree. Most people end up having at least a component of both. And I think there's a lot of branding of these procedures with actual names, or people, I think oftentimes they like saying that they're having a mini lift, a mini facelift, or a mini neck lift, because it makes it feel like it's not as big of an operation. But when I'm counseling patients, I remember in training seeing people, I was like, oh, we're going to see a mini facelift today. Curious about that. And then I realized, oh, that was that surgeon's, like, it was still the full facelift, but the patient was like, I'm having a mini facelift. So I think if you're going to go in for it, if you're going to have the scars, which should be beautiful at the end, but if you're going to go in and undergo the whole procedure, the recovery, then I think you ought to address everything, because you're going to be you're going to be entering the face and neck anyways.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.